Hey, gentlemen over 60, yeah. You, the guys who've lived enough life to know a thing or two? If you're still finding comfort in masturbation, I've got a truth bomb for you that could change everything. This isn't about pointing fingers or telling you to quit. Nope. It's about something way bigger, something nobody's talking about that might be quietly draining your energy, your confidence, and even your connection to the life you're meant to live. It's not about the act itself, but how you're doing it. And trust me, by the time this video's done, you'll look at those private moments in a whole new way, and you'll be itching to try a trick that could bring back the spark you thought was long gone. I'm Dr. James Harper, and for the past 25 years, I've been in the trenches with men in their 60s, 70s, and even 80s, helping them rediscover their fire, their strength, their drive, that feeling of being fully alive. In my clinic, I keep seeing one issue over and over. Something so common it's practically an epidemic, yet it's barely whispered about. Masturbation isn't just good or bad. Black or white, it's a tool. Wield it right, and it can keep you sharp, support your health, and lift your spirits. Get it wrong, and it might be working against you in ways you'd never suspect. Today, I'm breaking down the 8 hidden risks of masturbation after 60 things most doctors won't touch with a 10-foot pole that could be messing with your body, your mind, and even your relationships. These aren't just warnings. They're wake-up calls to help you take charge of your health and feel like the man you are. And here's the part you won't want to miss. Before we wrap up, I'm sharing a dead simple 7-second trick I teach my patients that can recharge your blood flow, rebuild your confidence, and make you feel like you're back in your Promeno prescriptions. No nonsense, just you owning your vitality. You're gonna want to stick around for that one, because it's a game changer. So, grab a seat, maybe a coffee, and let's get real about something that matters. If you're not subscribed yet, hit that button and tap the bell so you don't miss the health insights I share for men living their best years. In the comments, tell me does this topic hit close to home? Drop a 1 if it does, or a 0 if it's not your thing. Your feedback keeps me making content that speaks to you. Alright, let's dive into the first risk. It's not what you expect, and it's probably already sneaking into your life. Risk 1. Pulling away from the world. Expanded summary. This risk is about how masturbation can become a default comfort zone, leading to social and emotional isolation, especially for men over 60 who may be retired, widowed, or living alone. When life slows down, masturbation can feel like a quick fix for loneliness, boredom, or the ache of feeling disconnected. Over time, it can become a habit that pulls you inward, making you less likely to reach out to friends, family, or new connections. This matters because human connection, whether it's a conversation, a laugh, or a hugest like oxygen for your brain and body, it boosts your mood, supports your hormones, and keeps you feeling alive. Without it, you risk drifting into a cycle of isolation where masturbation fills a void it was never meant to fill. The good news? You can break this cycle by taking small steps to reconnect with the world, reminding yourself you're still wired for meaningful relationships, no matter your age. I'll never forget sitting across from Tom, a 68-year-old retired firefighter. The guy had a heart of gold, but his eyes carried a weight not from age, but from something deeper. After some small talk, he leaned in and said, "Doc, I haven't really connected with anyone in months. I masturbate to feel something, you know? Is that wrong?" It wasn't about the act, it was about the loneliness behind it. For a lot of guys in their 60s, 70s, or beyond, life can get quiet. Maybe you're retired, the kids are grown, or you're living solo. Those long, empty moments can turn into a routine where masturbation becomes your go-to way to feel a spark, even just for a second. There's no shame in that. It's human. But here's where it gets tricky. When masturbation becomes your only source of comfort, it can start to replace real human connection. You might find yourself skipping coffee with a buddy, passing on community events, or avoiding new conversations because going solo feels safer, easier, less risky than putting yourself out there. This isn't just about missing out on romance or physical intimacy. It's about missing out on life, The kind of life that comes from a good laugh with a friend, a handshake that feels solid, or a moment where you lock eyes with someone and feel seen. I've seen guys drift so far into their own world that they forget how good it feels to be part of something bigger. Human contact is like medicine night, fires up your brain, boosts your mood, even helps your testosterone levels. When you lean too heavily on masturbation, you risk building walls where you used to have bridges. And those walls can make your world feel smaller, quieter, lonelier. Now, don't get me wrong, this isn't about making you feel bad. It's a nudge to remember you're built for more than just going it alone. You're wired for connection, and that doesn't fade with age. No matter how long it's been since you felt truly connected, that spark is still in you. Start small. Call an old friend. Join a local group. Strike up a chat at the store. Maybe it's signing up for a community class or grabbing a beer with a neighbor. Intimacy isn't just physical, it's about showing up, being heard, and letting yourself feel human again. You've got stories, wisdom, and a whole lot to offer. The world's still waiting for you to step back in. Risk 2. Skin wear and tear. Expanded summary. As you age, your skin becomes thinner, less elastic, and slower to heal, making it more vulnerable to irritation or tiny tears, microlesions, from friction during masturbation, especially if you're not using proper lubrication or being too rough. These small injuries can cause redness, discomfort, or even infections if ignored, and over time, they can reduce sensitivity, making sexual experiences less enjoyable. This risk matters because it can affect your physical comfort, confidence, and even your perception of your body's health, leading you to think something's seriously wrong when it's often just a matter of technique. By making simple changes, like using lubricant and slowing down, you can protect your skin, preserve sensation, and keep masturbation a positive part of your life. A patient named Mike, early 70s, came to me with a concern he was almost too shy to share. "Doc," he said, his voice low, "I've been noticing some irritation, down there. It's been happening more lately, and I'm starting to worry." He sounded embarrassed, like he thought he should have outgrown masturbation by now, like it was something to hide. Here's the reality. Your body changes as you get older. The skin down there isn't as tough or springy as it was when you were 20. It's thinner, more delicate, and takes longer to bounce back. If you're masturbating without enough lubrication or with too much force, you can cause tiny tears or scrapes, what we call microlesions. At first, it might just be a bit of redness, a slight sting afterward, or a feeling of tenderness that lingers for a few hours. Most guys brush it off, thinking it's no big deal. But over time, those small injuries can add up, leading to chronic inflammation, reduced sensitivity, or, in rare cases, infections if bacteria or fungi get a foothold in that warm, moist area. The worst part? A lot of guys think this discomfort means something's wrong with their hormones, their nerves, or even their masculinity. They start to worry they're broken, when, really, it's just about how they're approaching things. Your body's not failing you, it's just asking for a little more care. So, how do you fix this? First, take it easy. You're not in a race to the finish line. Masturbation's about connecting with yourself, not proving a point. Second, always use a high-quality, water-based lubricant of that makeshift stuff like lotion, petroleum jelly, or spit. A good lube cuts down on friction, protects your skin, and can actually make the experience feel better. Third, slow down and be gentle. You're not 25 anymore, and that's not a weakness. It's a reason to treat your body with the respect it's earned. When you make these small tweaks, you're not just preventing damage, you're keeping sensation strong, so those private moments stay satisfying for years to come. And here's a pro tip. Check in with your body afterward. If you notice redness or discomfort, give it a rest for a day or two and use a soothing, fragrance-free moisturizer to help your skin recover. Your body's still got a lot to give. Treat it like the ally it is. Risk 3. Losing your sensitivity. Expanded summary. Repeating the same masturbation routine, same grip, same rhythm, same mental images, often with adult content, can condition your brain to associate pleasure only with that specific pattern, leading to desensitization, This makes it harder to feel aroused with a partner, requires more intensity to get the same result, or makes climaxing difficult without recreating your solo setup. This risk is critical because it can create distance in relationships, lower your confidence, and make intimacy feel like work, when it's really a neurological issue that can be retrained. By varying your approach and relying on imagination, you can restore sensitivity and reconnect with natural pleasure. I had a patient, Steve, 65, sharp as a tack, still working part-time. But when he sat in my office, he looked like he'd lost a fight. "Doc," he said, "I can still make things happen when I masturbate, but with my partner, it's different. I don't feel as much anymore. What's wrong with me?" That kind of defeat in his voice, it's something I hear more often than you'd think. This isn't always about low testosterone or poor circulation, though those can play a role. Sometimes it's what I call neural conditioning. When you masturbate the same way every time, same tight grip, same fast rhythm, same adult content on a screen, your brain starts to wire pleasure to only that exact routine. It's like carving a deep groove in a dirt path. Everything flows to that one spot, and other paths get overgrown. Over time, this can lead to desensitization. You might struggle to get aroused with a partner, need more intensity to feel anything, or find it hard to finish unless you're recreating that solo setup. For a lot of guys, this feels like a personal failure. It's not. It's not even always a medical issue, it's your brain getting stuck in a rut. The more you rely on the same pattern, especially with hyperstimulating content, the harder it is for your brain to respond to the slower, more organic sensations of real-life intimacy. It can make sex with a partner feel like work, or leave you feeling disconnected, frustrated, even embarrassed. But here's the good news. Your brain is adaptable. You can retrain it. Start by mixing things up. Try a lighter touch, a slower pace, or a different position. Lean on your imagination. Instead of external stimuli, think about a memory or a fantasy that feels personal. And most importantly, take your time. Masturbation isn't about rushing to the end, it's about rediscovering what feels good. When you introduce variety, you're not just waking up your body, you're rewiring your brain to respond to a broader range of sensations. I've seen guys who thought they'd lost their spark completely turn things around just by practicing differently. No pills, no procedures, just patience and curiosity. Your nervous system's not broken, it's just been trained too narrowly. Give it permission to explore, and you'll be amazed at how much you can feel again, whether you're alone or with someone else. Risk 4. Missing bigger health signals. Expanded summary. Masturbation can mask early signs of erectile dysfunction, ED, which may point to serious health issues like heart disease, diabetes, or low testosterone. Because masturbation is often easier mentally and physically than intimacy with a partner, men may assume everything's fine if they can still perform solo, missing critical warning signs. This is a big deal because ED can be an early indicator of cardiovascular or hormonal problems that are treatable if caught early. Ignoring these signals can delay care and worsen outcomes, but talking to a doctor can help you address the root cause and reclaim your vitality. I remember a patient, Dave, late 60s, in great shape, married for decades. He finally opened up after months of avoiding the topic. "I can still get going when I masturbate, doc," he said, "but with my wife, it's hit or miss. So I just stopped trying." That moment was heavy, not because he was broken, but because he didn't realize his body was waving a red flag. Your ability to get and maintain an erection with a partner is like a check engine light for your health. When blood flow slows, arteries stiffen, hormones dip, or nerves lose their edge, your performance with someone else is often the first thing to change. Masturbation, though, is usually easier. It doesn't require the same emotional or physical complexity. So, a lot of guys assume they're fine because they can still function solo. That's where the danger lies. Masturbation can hide early-stage erectile dysfunction, which could be a sign of bigger issues like heart disease, blood sugar imbalances, or low testosterone. These are all things that, if caught early, can often be treated without invasive measures. But if you rely only on solo sessions, You might miss those warning signs until they're harder to fix. I had a patient who ignored this for a year, thinking it was just an age thing. Turned out, it was an early sign of clogged arteries problem we caught and addressed before it became life-threatening. That's why I tell every guy over 60, needing help isn't a weakness. Waiting is risky. Silence is risky. If you notice your erections are less reliable with a partner but fine when you masturbate, don't shrug it off. Find a doctor you trust, someone who sees you as a whole person, not just a symptom. And here's the thing. Addressing this isn't just about fixing a physical issue. It's about reclaiming your life, your confidence, your connection, your sense of self. You deserve that, not a temporary workaround. A simple checkup could be the difference between feeling stuck and feeling alive again. Risk 5. Pinching a nerve. Expanded summary. Poor posture during masturbation, like slouching on a hard chair or hunching over, can compress the pudendal nerve, which controls sensation in your pelvic area. This can lead to numbness, tingling, or pain, often mistaken for hormonal or desire issues when it's actually a mechanical problem. This risk matters because it can affect your comfort, sexual health, and confidence, but it's easily preventable with mindful posture changes. Left unaddressed, it can become chronic, but small adjustments can restore sensation and prevent long-term damage. A couple of years ago, Frank, early 70s, came to me with a strange issue. "Doc, I've got this numb, heavy feeling in my groin," he said. "It's been getting worse, and I'm worried it's just my age catching up. We ruled out circulation problems, but it wasn't that." It was neurological, and the culprit was so simple it's almost laughable. How he was sitting when he masturbated. Here's something most guys don't think about. Posture matters, especially during masturbation. As you get older, you might spend more time in chairs or hunched over for privacy. That pressure, especially on hard surfaces, can slowly compress the pudendal nerve, which is responsible for sensation in your pelvic area, including your penis and surrounding regions. Over time, this can cause numbness, tingling, a weird buzzing feeling, or even pain during or after sexual activity. It starts subtly. Maybe you notice you're less responsive, or there's an odd sensation that lingers. Most guys think it's their hormones or desire fading, when it's really just mechanics. If ignored, this nerve compression can become chronic, making it harder to reverse. But the good news, it's preventable and often fixable with simple changes. First, be mindful of how you sit. Avoid masturbating while slouched on a hard chair or leaning forward. Instead, try a reclined or lying down position where your spine and pelvis are supported. Pop a pillow under your knees to take pressure off your lower back and open up your pelvic area. Throughout the day, take breaks from sitting stand up. Stretch, walk around, let the blood flow. Your nerves need movement just as much as your muscles do. I tell my patients, comfort isn't a luxury, it's protection. How you position yourself during private moments says a lot about how you're caring for your long-term health. When you give your nerves room to breathe, you're giving your body permission to feel again. And that's not just about physical sensation, it's about feeling confident, connected, and in tune with yourself. Risk 6. Using it as an emotional escape. Expanded summary. For many men over 60, especially those in quieter life stages like retirement or living alone, masturbation can become a way to cope with stress, loneliness, or boredom. While it offers temporary relief through feel-good hormones like dopamine and oxytocin, relying on it as your only emotional outlet can lead to avoidance of deeper feelings and withdrawal from social life. This matters because it can trap you in a cycle of isolation, making it harder to find joy in relationships or hobbies. Building new ways to process emotions like talking to others or staying active can break this cycle and help you feel truly alive. Robert, late 60s, sat across from me one day and said something that stuck. "Some days," he told me, "I'm just tired of feeling everything. Stress, loneliness, you name it. Masturbation shuts it off for a bit." He wasn't talking about desire. He was talking about the weight of days that feel too quiet, when nobody calls, nobody checks in, and life starts to blur together. For a lot of guys, over 60, especially if you're retired, widowed, or on your own, masturbation can become more than just a physical release. It's a way to quiet the noise in your head, to push away the loneliness or boredom that creeps in when life slows down. It's not about chasing pleasure, it's about chasing relief, even for a moment. And that's understandable. Masturbation can lower stress and release a cocktail of hormones: dopamine, oxytocin, prolactin, that make you feel calm, safe, maybe even a little loved for a second. But here's the catch. When it becomes your only way to cope, it can turn into a trap. You might start skipping social outings, avoiding phone calls, or losing interest in hobbies because it's easier to stay home and get that quick hit of control. I've seen guys pull back from life not because they don't want connection, but because masturbation feels like the path of least resistance. It's predictable, it's private, and it doesn't ask you to be vulnerable. There's no shame in needing comfort, every man does, no matter his age. But if masturbation's your only tool for handling tough emotions, it's time to expand your toolbox. Start small. Call a friend and catch up over coffee. Talk to a counselor or join a support group where you can share what's on your mind. Get your body moving, take a walk. Try a new hobby like woodworking or gardening. Find rhythms that make you feel alive, not just distracted. Because here's the truth. No matter how good that release feels, it can't replace the spark of a real conversation, the purpose of being part of something bigger, or the joy of feeling connected to the world. You deserve emotional strength, and that comes from facing your feelings with choice, not habit. You're not just a guy passing time, you're a man with stories, passions, and a life worth living fully. Risk 7. Carrying quiet shame. Expanded summary. Many men, especially those raised in traditional or religious environments, carry deep-seated guilt or shame about masturbation, even decades later. This emotional burden can increase stress hormones, disrupt your nervous system, and make you feel unworthy of connection or pleasure. This is critical because it can erode your confidence, strain relationships, and dim the joy you're meant to feel. Reframing masturbation as a healthy act of self-care and seeking support, if needed, can free you from this weight and help you embrace your desires without apology. Paul, 72, a retired pastor, sat in my office with a soft voice and heavy eyes. When we started talking about his sexual health, he looked down and said, "Doc, I still masturbate sometimes, and afterward, I feel like I've done something wrong. I can't even look at myself." That quiet shame in his voice, it's something I've heard from so many men, and it cuts deeper than most realize. For a lot of guys, especially those who grew up in strict or traditional homes, masturbation was framed as something to be ashamed of, sinful, weak, or even dirty. Those messages don't just vanish with time. They linger, like a shadow that follows you even when you think you've moved on. I've met men in their 60s, 70s, and beyond who carry that guilt silently, never talking about it with friends, never bringing it up with a doctor, just feeling it every time they masturbate. It's like a weight they've accepted as part of life, without ever questioning if it's true. That shame doesn't just hurt your heart, it can raise cortisol levels, stress your nervous system, and even dull your ability to enjoy pleasure. It chips away at your confidence, clouds your relationships, and makes you feel like you don't deserve the connection or joy you're built for. And that's not just unfair, it's unnecessary. Here's what I want you to hear loud and clear. There's nothing wrong with masturbation. It's not a flaw, a sin, or a failure, it's human. Especially in this stage of life, where intimacy can be harder to come by, but just as vital. Masturbation is a simple way to care for your physical and emotional health. When done with intention and balance, it's an act of self-respect, a way to honor your body and your needs. If you've been carrying that guilt for years, it's time to let it go. That might mean talking to a therapist who understands aging or sexual health. Someone trained in sex-positive care can make a huge difference. Or it might mean rewriting the story in your own head, swapping judgment for compassion, shame for gratitude. You're not broken. You're not dirty. You're a man with desires, needs, and a story worth celebrating. You have every right to carry those without apology, to feel good in your own skin, and to embrace the life you're living right now. Risk 8. Physical overload. Expanded summary. Frequent masturbation without enough recovery time can cause pelvic congestion, a buildup of blood and pressure in the pelvic region, leading to a heavy, dull ache or lingering discomfort. This is especially common in older men with quieter lifestyles, like retirees, who may turn to masturbation to fill time or cope with stress. This matters because it can affect your physical comfort, sexual health, and overall well-being, making you feel off without knowing why. Spacing out sessions and giving your body time to reset can prevent this and make sexual experiences more satisfying. Mark, late 60s, came to me with a complaint he couldn't quite pin down. "Doc, it's hard to explain," he said. "There's this heavy, dull ache down there. Not sharp, just always there, like something's not right." We ruled out infections, and his prostate checked out fine. But when I asked about his habits, it all clicked. Since retiring, Mark's days had gotten quieter. He was home more, less active, and found himself masturbating to deal with boredom or stress, not occasionally, but daily, sometimes, multiple times. "It gives me something to do," he said, "but lately, I feel worse." What he was experiencing was pelvic congestion, a buildup of blood and pressure in the pelvic region from frequent masturbation without enough recovery time. When you overdo it, especially over long periods, the tissues and blood vessels in your pelvic floor can get irritated or inflamed. You might feel a heaviness in your groin, a deep ache behind your pelvic bone, or a lingering discomfort that's hard to shake. It's not about morality or doing something wrong, it's about balance. Your body, especially as you age, needs time to reset. The systems that manage blood flow, hormones, and muscle contractions are more sensitive now than they were at 25. That doesn't mean you're fragile, it means you're wise enough to listen to what your body's telling you. If you're noticing that heavy ache or strain after frequent masturbation, your body's asking for a breather. For most guys over 60, spacing things out by a few days works best, not because more is bad, but because recovery is just as important as the act itself. Less isn't less, it's smarter. When you give your body time to recharge, the sensations often come back stronger, more vivid, more satisfying. Try this. If you feel that discomfort, take a break for a couple of days and focus on gentle movement, like walking or stretching, to get blood flowing. Pay attention to how your body feels afterward. You don't have to live with that ache or ignore your body's signals. A small tweak in timing can make a huge difference in how you feel physically, emotionally, and beyond. You're not just preserving your health, you're setting yourself up to enjoy those moments even more. The game changer. A 7-second fix. All right. We've walked through these 8 risks, from drifting away from the world to physical strain. Masturbation after 60 isn't about being good or bad, it's a tool, and how you use it decides whether it lifts you up or wears you down. These risks aren't here to scare you, they're here to empower you, to give you the awareness and permission to take better care of yourself. Because this stage of life isn't about giving things up, it's about doing them smarter, with more intention, more care, and more wisdom. Your body's still responding, your desires still matter, and with a few small changes, masturbation can be a source of strength, not shame. Here's the 7-second trick I teach my patients to boost blood flow, rebuild confidence, and bring back vitality. Every morning, take 7 seconds to do a quick pelvic floor contraction. Tighten the muscles you'd use to stop peeing midstream. Hold for 3 seconds, then release for 4. Do this 5 times in a row. It's subtle. You can do it anywhere, sitting at breakfast, waiting at a stoplight, and it strengthens the muscles that support blood flow and sensation. Over time, it can make you feel stronger, more connected, more alive. I've seen guys in their 70s and 80s light up when they start this suddenly. They're feeling things they thought were gone for good. It's not magic. It's your body responding to a little care. Try it tomorrow morning and see how it feels. You might be surprised at the difference it makes. If this spoke to you, drop a 1 in the comments and let me know your thoughts, maybe something that hit home or a question you've got. If it's not your thing, a 0 works too. I'm here to keep sharing tips that help you live fully, no matter your age. Subscribe, hit the bell, and let's keep this conversation going. Because you deserve to feel good inside and out, today and for years to come.